and welcome again to my channel. I am your baby's doctor. I'm Ayobola Dibowale, and it's always a pleasure having you here. If you're just joining us for the very first time, yay, welcome. It is always very nice to have new people here. Thank you so much for creating time to watch this video. I appreciate it. Okay, so about today's video, I have been procrastinating. Because I've been procrastinating for some time. I had written the manuscript and I don't know, I just kept it somewhere, and I just kept saying one day I'll record this video, one day I'll talk about birth asphyxia. But a while back I made a post on Twitter that got a lot of attention, and I had people asking me questions about birth asphyxia, and of course that made me think that yes, this is the right time for me to make that video. So today we'll be talking about birth asphyxia, and I hope that at the end of this video you would have learned a lot and your mind about a lot of things would have changed. All right, so thank you so much for tuning in. All right, welcome back. Before we go ahead, if you like this video, click the like button. I know you like the video. And if you're just joining us for the first time, you've not subscribed, please click the subscribe button and click the notification bell so that you can get notified each time I post a video. Alright, so birth asphyxia. Okay, let's get to the serious matter now, because birth asphyxia is a serious problem. It has been a serious problem. It is still a serious problem, and if we don't handle it very well, it will remain a very serious problem. So birth asphyxia occurs when a newborn refuses to breathe in the first few minutes of life. And you know that inside the uterus, the child is connected to the placenta, which connects the child to the mother, and the child gets oxygen and other nutrients directly from the mother. So when you give birth to a baby and you sever the placenta, you expect that the child should actually take his or her first breath, cries, and of course opens up the airway and the baby can breathe. And when this happens, there is oxygen supply and nutrient supply to the brain and other vital organs. So when this does not happen, when even sometimes the child might even give a weak cry and the airway does not open, or there are some other things which we'll talk about later on in this video, that can lead to birth asphyxia. So when all these things happen, there is low oxygen supply to the brain and other vital organs, and the child has what we call birth asphyxia. So like I said, birth asphyxia has always been a problem. It was a problem, it is still a problem, especially in the low and middle income countries such as Nigeria, where we have influx of plenty babies with perinatal asphyxia, also known as birth asphyxia. And I think this is the right time for us to have this video so that we can address the issues, we can talk about it, we can get educated, we can know the risk factors for birth asphyxia, we can know how to avoid it, and of course seek medical help when necessary. For you to know how bad birth asphyxia is, it accounts for 23% of neonatal mortality. So this is what I'm talking about. For children that are 28 days and less, they are called neonates. So children that die between this period, they are called neonatal mortality. So out of all the babies that die in the first 28 days of life, 23% of them are due to birth asphyxia. That is quite a lot, and that is why we need, and it's very preventable. So if it's preventable, it shouldn't be happening. So that is why we need to get educated and know more about perinatal asphyxia. So let's go straight to the risk factors or the causes of birth asphyxia. And I would like to divide them into two: in utero and outside. All right, so when the baby is still in the uterus, the baby is predisposed in some cases to birth asphyxia. For example, placental abruptio, in which there is a premature detachment of the placenta from the mother's uterus. So the baby is still in utero, but there is no oxygen supply, there is no nutrient supply or blood supply from the mother to the baby. So this can predispose a child to perinatal asphyxia. Some other things that can cause perinatal asphyxia: preeclampsia, hypertension, maternal hypertension, eclampsia, that's when the mother starts convulsing. Other things like cord around the neck. So when there's a cord around the neck, it keeps pulling back the baby, and of course can cause injury to the airway. And of course, very important is prolonged labor, prolonged difficult labor, in which the mother has tried and tried to give birth to the child for it. So those are some of the things that can actually predispose a child to perinatal asphyxia. So now let's assume that the child did not even have any of this in utero. The child was delivered. When a child comes out of the uterus, usually we'll sever the placenta. Okay, so I'm not talking as the obstetrician now. I'm just saying, of course, from my basic medical science, this is what I learned. So we sever the placenta and the baby should cry. But in some cases, the child might have some fluid, mucus, and meconium. That's the first two, even in the mouth, that is blocking the airway. So this child, even though the child is trying to take that first breath, is unable to breathe. So the child will need attention in the sense that you have to like suck the substance that is obstructing the airway, even if it's blood clots, blood in some cases. You suck it out and you'll be surprised that the baby will actually cry thereafter. And that is why the concept of the golden minute was created. So it's said that a baby's first minute determines a lot about the baby's life. Okay, so that first minute of the baby's life is very, very important, and the things we do to a baby in that first minute matters a lot. And this is what it means. It means that during that first minute of birth, the baby should cry or breathe, right? And if the baby does not breathe spontaneously, it means that there is a need for neonatal resuscitation. There is a need for medical help. There is a need for someone to actually try to help the baby breathe. And what they do is they clear the airway, and if the baby is still not breathing after that, they can help the baby breathe by using what we call the ambu bag, okay, to help with the breathing. Okay, so this is the concept of the golden minute, which means that either the baby cries spontaneously or we help the baby. This baby must attain breathing in the first minutes of life. So that is what the concept of the golden minute is about. And for you to know that it is actually very, very important. A lot of children, even though they did not cry immediately after birth, but if they get adequate help in the first few minutes of life, you'll be surprised that they will not come out. They come down with any form of deficit. So it is very, very important to know what perinatal asphyxia is and to know what to do when a child has perinatal asphyxia. So briefly, I'll just talk about some things that could suggest that a child has perinatal asphyxia. Well, there are quite a number of things. If the child is delivered at a good healthcare facility, once the child does not breathe well at birth and needs what we call extensive resuscitation, it means that that child might actually suffer from perinatal asphyxia and would need special care. And this is why, well, okay, now let's talk about home birth. I know a lot of people talk about home birth, how nice it is, and all of that. Well, maybe in the developed countries, it's a nice thing because, one, you have access to midwives. You have access to not just midwives, trained midwives, and you have access to emergency services in the sense that if things go awry, you know what to do, you know who to call, okay? But in poorly developed countries, that is a very risky thing to do, and that is why up until today I don't encourage mothers that say they want to deliver a baby in their house. This is because childbirth and the process of delivery itself is risky, so it's associated with a lot of risks, and it is better not to take these risks yourselves at home. It is better to take the risk with people that have been trained particularly in that area. So I do not actually encourage mothers, especially, well, I'm from Nigeria. I practice currently in Nigeria. So I don't encourage mothers in Nigeria to actually take home deliveries. And you see, a lot of cases of perinatal asphyxia that we have, the mother would have gone to traditional birth attendants, would have gone to maybe some under-G nurses and some quack doctors too. So they would have tried everything. They would have tried all the methods possible to deliver that baby. And when they cannot deliver the baby again, then they will bring the baby to a healthcare professional. And of course, like every other thing, there's already a delay. There is a delay on like several levels, okay? And of course, the chances reduces with the amount of time you spend in all those places. So please, I would actually, for now, maybe later when things get better, when our healthcare system is more optimized, then we can start encouraging, because honestly, that would also reduce the workload on doctors and nurses in tertiary and secondary and primary institutions. Okay, but for now, I'll still advise that we stay away from home births. And of course, in some cases, it is not preventable. So in some cases, you have a precipitated labor, especially for people that are experienced with labor. So they have the pain, they're like, oh, okay, it's just starting, it's not much of a big deal yet. And before you know it, you have the urge to push and you have no choice, you have to deliver that baby. So that's one of the cases where, well, womb birth can happen. In other cases, well, some people give the excuse that they didn't have access to healthcare, they were in a place where they couldn't go out at night, there was nobody to bring them to the hospital, so they had to resort to that. As much as I feel like that is not exactly a big excuse, but then if it happens that at any point in time you deliver your baby at home, that is not a baby to keep at home. You need to take the baby to the hospital, let the baby be evaluated, let them check the baby and be sure that there is absolutely nothing wrong with the baby, and then you can take your baby home and prepare for the naming ceremony. But in a situation where you deliver a baby at home and then your baby does not even cry and then you keep the baby at home, it becomes a very big cause of concern. So please do not, for now, deliver your baby at home. And then if by chance or something happens, you're unable to get to a hospital and then you have to deliver the baby at home, please take the baby to a healthcare facility where they can assess your child and give adequate care as necessary. So I was talking about the symptoms of birth asphyxia. So apart from the poor cry at birth, some babies would then start convulsing. Some of them would not accept your feed. You're trying to feed, the baby is not taking the food. Some of them will even develop a fever. Some of them are lethargic, that is, they are weak, they are not active, and some of them can have abnormal movements such as smacking of the lips, blinking of the eyes, having this very funny smile. Some of them would even be crying with this high-pitched cry, and they have that cry. And of course, in a lot of cases, people, actually for a child that did not cry at birth, the person, the caregiver, is excited. Yay! Now my baby is finally crying, but it means that there's something sinister going on in that child's brain and the child needs to be evaluated. So those are some of the things that you need to watch out for in your babies. Hopefully we would be able to reduce the incidence of birth asphyxia as we educate mothers and ourselves, our friends, and other caregivers around the world. But before I go, I'll briefly like to tell us again that when it comes to birth asphyxia, prevention is always better than cure. When it comes to everything, prevention is better than cure. But when it comes to birth asphyxia itself, prevention is better not to have it at all, because when a child has asphyxia, however minute that asphyxia may be, you can't really know the outcome until the child grows up onto a particular point and you expect that, okay, at this age I expect that my baby should attain neck control, and then it does not happen. That is when you start discovering that, okay, the baby's development is slow, okay, there is a problem and all that. So please, prevention when it comes to birth asphyxia, please. Prevention is always better than cure. So please, as much as possible, go for antenatal care. Let them have ultrasound done from time to time as requested by your obstetrician. Do everything that they tell you to do during the course of your antenatal care. Go to a certified hospital. I know that things, when it comes to money, some places are expensive, but there are some places that are actually not expensive and they give optimal care. Please go there. It's better to, spend money now than spend the money for the rest of your child's life. So please go to the hospital. If you have any problems with your pregnancy or with your newborn, please go to the hospital. I always say it, I never chase worried mothers away, no matter how overbearing, no matter how annoying they are. Even when I get angry, I still calm down and I tell them, okay, bring the baby. What did you say is wrong with the baby? Okay, so a typical pediatrician will not send you away. Even though, of course, sometimes they're overworked and stressed, but they will still not send you away. They will still ask you, okay, so what did you say is wrong with the baby? They will examine and tell you that there is nothing wrong. So it's better for you to go to a doctor, a specialist, and the person checks your baby and says there is absolutely nothing wrong than just sitting down at home and assuming that all is well. So please, prevention of perinatal asphyxia is very important. Antenatal care cannot be overemphasized. The need to deliver as a very good place cannot be overemphasized. And of course, medical practitioners, you already know you have to do the right thing after a baby is born. Okay, so the golden minute concept is very important in the care of the newborn. So hopefully, I pray that with this video those of you that are planning to deliver your babies at home, I pray you have changed your mind. All right, so please let's join our hands together to reduce the incidence and the mortality associated with perinatal asphyxia worldwide. So thank you so much for joining me today. I won't go into the complications of that asphyxia. Maybe in subsequent videos, I'll actually make some other videos that will talk about cerebral palsy and some other things that can be epilepsy that can be associated with perinatal asphyxia. I don't want the video to be extremely long. Alright, so thank you so much for your time. Every minute that you spent with me today is golden, and I appreciate it so much. So please remember to share, because we need this message to go everywhere. Remember to share, like, I know you like it, so like, subscribe, and click the notification bell so that you can get notified every time I post a new video. Thank you so much for joining me, and remember to follow me on social media outlets: Twitter, Instagram, Facebook at Your Baby's Doctor.